Doctor, it's also a question of the weapons to fight the variants. There's a raging debate on the efficacy of the vaccines, especially against Delta. Ano po yung masasabi niyo dyan? Medyo within the medical community itself, hindi yata nagkakasundo yung, well, a small group against the bigger group.
Well, you know, we just base it on the science. What is the evidence available? What is the evidence is showing, not only from our data, but mostly from data abroad, from the countries that have already been doing most of the surveillance, is that, yes, there's a reduction. There seems to be a reduction in terms of antibody levels against the Delta variant. But we have to remember that we have to consider so many other things. For example, remember, antibodies are not the sole measure of protection. In fact, it is only being used because that is the test that is readily available. You talk to any scientist, there is still no proven correlate for protection. What do I mean by that? It doesn't mean that your antibodies are high, that you are protected, in much the same way that if your antibodies are low or absent, that you are not protected. And why is this? Because we are not capturing the other arm of the immune system, which are the cells, our memory cells. Well, I can be a little technical. We have T cells, B cells, killer cells, all of these, which are not measured by your antibodies. And we all know, based on our knowledge on vaccine efficacy and effectivity, that in fact, these are the ones that matter in the long term, not in the short term, in the long term. So patients may have a declining levels of antibodies, but they're still protected. Why? Because when they're exposed to the infectious organism, they're able to mount the protection which is provided by the other cells, you know, the T cells, the B cells, and all of these killer cells. So I think we have to bear that in mind. And we are basing it on what we have always used as a basis, traditionally, historically, going through preclinical and clinical studies, phase 1, phase 2, and phase 3. Nagdaan po lahat yan dyan. Wala pong nag-shortcut. People say, makaumikli yung pag-examine. Hindi po. Ganun pa rin ang ginawang paraan. And it was faster because people, companies actually help each other, accelerated their development process because they know of the urgency. At yung technologies na ginagamit nila has already been used as early as the SARS-CoV in 2003. So it's not entirely a new technology. Hindi lang nagamit ng kasing dami at kasing laki ng application as we see now because of the global pandemic. So let's bear that in mind. But we have complete trust and confidence in the ability of our experts in our Food and Drug Administration, both here and abroad, to study the data as they come and to update and revise whatever recommendations are existing, so that we're able to respond to the current situation and base it on the best available evidence.
Yusek, balikan ko lang po yung ano nyo about the antibodies because parang parang topic of conversation yan sa mga Viber groups, sa mga kaibigan, sa mga pamilya. I don't know if I'm getting it correctly, but I want you to expound again and explain sa amin kung bakit yung nababasa nyo ng mga results na bumababa ang antibodies, hindi yan necessarily ang measure. Let's not panic. So, tama po ba pagkakaintindi ko? Pwedeng bababa talaga yung antibodies. But in the meantime, the vaccine will already train your body to produce the antibodies when the time comes. Ganun po ba yun?
Yes. Yes, that's very correct. Because you're actually looking at the full picture of how our immune system works. Remember, if you're just dependent on antibodies alone, we would not have controlled many diseases through vaccination. And that is precisely why vaccines work. Because they do not only work on our antibodies, that's the humoral side, but we also have what we call the cellular side or the cells, which carry the memory. In other words, they were exposed before, but now they are confronted with the same organism which they recognize based on their memory. That's their memory cells. That's why I call it memory cells. Those are the ones that are activated. These were not present during the initial exposure, which means in the second exposure, the host or the human person can immediately produce the antibody levels high enough to neutralize the virus and also the cells, the killer cells that will actually kill the virus. So they work in tandem. So in the long term, the cellular immune system is already working as well. So that's the how we look at how vaccines work in its entirety.